Dr. Farmer, thanks so much for coming on to the show today. We're so grateful to have you here.
Welcome.
Well, thank you. Thank you for the invitation. It's a real honor to be with you here. I've been really enjoying your podcasts, and I have to say I really love your accents.
Oh, no. We like yours too.
I thought I'd get in first with that one, right?
That's a good one. You got me there. You got me. I like it.
So I'm from down under, commonly referred to Australia. I'm the west coast of Australia. We're 13 hours ahead of you. So this is tomorrow for you.
Yes.
So I can tell you've got a good day coming up.
Yes, we are looking into the future.
Awesome.
That's it. And that's what PBM's about, right? Looking at the future.
Yes.
Love it. Tell us a little bit about how you got into patient blood management.
I think you're probably aware of the story in the book about my father. And that was a landmark moment for me. And that really shaped my whole life, my whole career in this area of medicine, patient-centered care, and advocacy.
So, Shannon, there's just such a buzz around this book, and it's been just incredibly well reviewed by the medical community, even reviews from the non-medical community who've had their advanced copies just have been fantastic. People are raving about the book. So why are you personally excited about the book?
Well, after 3 years of hard work by all involved, the book turned out the way we hoped it would. There was a real need to have a book on blood health that the average person, non-medical person around the world could easily read. And we're so pleased we achieved that. And without compromising the scientific integrity. It's robust scientifically. It's meticulously researched. And comments by those who have read it are that it is readable, it's understandable, not intimidating, and uses everyday language to explain what can be quite confusing medical jargon, right? And it's already helped those who have read it. That's very gratifying. There is one chapter that has some quite complex concepts on iron physiology and anemia. And many doctors struggle with this, right? Mm-hmm. We worked really hard to try and simplify this and make it understandable. We then gave the chapter to a grandmother to test and see how we'd done. And she replied saying, yes, I understood it. And to our delight, she actually explained it back to us. So she got it and we felt we'd achieve what we're looking for.
Nice.
Yeah.
Another thing that we are really pleased about is how this is going to help people in low and middle income countries. So many parts of the world, providing good health care is very challenging and a major issue in blood health. I've spent quite a lot of time in various parts of Africa and some other low-income countries lecturing and teaching. And, it's really heartbreaking to see the conditions in those countries with regard to healthcare and how seriously stretched health resources are.
Yep.
They don't have access to things that we take for granted and complain if we don't have them. We've had great feedback from these areas that this book will be enormously helpful, that it provides immediate, simple, safe solutions for patients and healthcare providers in these places. And in my mind, a truly inspiring chapter in the book is when healthcare resources are stretched. It documents the story of an amazing couple, a surgeon and an anesthesiologist from Germany, who have spent a lot of time in rural, remote Africa, places where they often have no blood for transfusion. And if they do, there's a really high risk it'll be contaminated. Now, they set up a shipping container as an operating room and set it up with very simple, basic surgical equipment and medical equipment. And they, moving this around various parts of Africa, have successfully performed major surgeries, lung resections, lung surgery, cesarean sections, hysterectomies, major orthopedic surgery, burns, trauma, using the fundamental principles of PBM. Now, this can make a difference to millions of lives in those countries. Yeah. And we are very grateful to the publishers and all the working team behind the scenes who made a great job of making this book look so good. It's so reader or user friendly, if you like. It just draws you in, the graphics, the diagrams, the images, the boxes, the summaries, and so on. Yeah, so we're very excited about it. Very grateful.
I especially love the overview and the nutshell, because in just an easy 90 seconds, you get a introduction to what you're going to read and learn in that chapter. And then in the nutshell at the end, it summarizes for you the key points. And that's just so user friendly.
Yep. Yeah.
That's nice to hear. Thank you. Thank you.
Mm-hmm.
Yeah, definitely. And I loved the introduction to the book. Just powerful, emotional, just feels so honest. And, you know, you and your wife, Kristen, have gone through your own traumas, right? Yeah.
Yep. And, you know, at Let's Talk PBM, we love hearing from the ladies. And you did mention off camera that she has played a major role in making sure that the book was understandable from a layperson's perspective.
That's for
and
sure.
you said that she was around today. And I was just wondering if we could ask her to pop in and kind of ask her a little bit about her experience and some brief questions.
Yeah, sure.
Hello, MaryAnn. Hi, Sarah.
Hi, welcome to Let's Talk Patient Blood Management, and thanks so much for joining us.
Oh, well, this is pressure.
We really wanted to get a chance to meet you because you're a big part of this book as well. You know, your blood, sweat, and tears are in it. And so I hope that it's not pressure at all.
Oh, thank you.
And she can handle pressure. She has to put up with pressure from me all the time.
You're not kidding.
But Kristen just worked on this book the whole time. Mm-hmm. She was the person who made sure it was understandable to the non-medical reader. And she would tell us, no, can't understand that. You have to work on that. So we're very grateful to her work.
Yeah. Wonderful. You. Oh, you know, it shows. Yeah. You know, we've heard that you've had your own personal health issues. And we just want to ask you about that.
Well, there were really 3 major incidents in my life where interactions with the medical system made me see the importance of having personal support. So it starts with probably my own experience with needing someone to help me in this way. And it began like it does for so many people, from being quite healthy. I was suddenly given a breast cancer diagnosis and I became a patient. Yeah, it turned my world upside down. And really, as soon as I heard that word, I was in a different place. I had had a melanoma a year previously, so it was my second diagnosis, but this was big. So Shannon was away when my doctor told me, and while there was not much detail at that visit, I didn't take in a lot of what she said anyway. Mm-hmm. I was very glad when Shannon got home and was able to accompany me on my medical visits. Just to have my husband with me was calming, but he was able to take in detail that I sometimes found a real challenge to take in. I was grateful to have an oncologist to explain things well, my situation, my options, along with the risks and benefits. But as good as she was, my head often swam with the detail. It really did. And I was so helpful to have Shannon there to grab the information so that we could discuss things together.
Oh, boy. Yeah. Just incredible. Yeah.
Several years later, Shannon was diagnosed with non-Hodgkin's lymphoma, which he was treated for. I'll never forget how I felt when they found that it had returned in a more vicious form 3 years later. It required long, grueling treatment. So rather than him caring for me, our roles were switched, and that was another long haul. On top of that, during his second treatment, his elderly mum became quite ill with advanced heart failure and came to live with us.
Oh, my gosh.
We nursed her at home with us until she died at 93 years of age, and her care became quite intense. Sure. There were several instances in her care where it became apparent that it was a very good thing that she had us as her advocates.
Yeah.
Family usually knows family very well, right? And extra eyes and ears can be useful in making sure that a patient gets appropriate care that is in accordance with their wishes. And we were really grateful we were able to do that for her.
Boy, that's just so beautiful. And, it brings up a really good point in my mind that sometimes, in the medical world, we forget that each professional has their own story of personal trauma and what drives them, what got you into patient blood management, what makes you do what you're doing today. And Dr. Shander, we spoke to a couple of weeks ago, and he mentioned that we're all going to be patients too one day. And boy, you both really have that experience firsthand,
Yeah, it does make a big difference if you're involved in medicine to become a patient and go through the system. It's a very valuable learning experience.
You see the medical system in a whole new light.
Yeah. We had this little thing, though. I said to Kristen after my third diagnosis with malignancy, I said, look, I've had 3, you've had 2, I win, let's stop now.
Love it.
I figure that's a good idea.
Yeah.
It's not a game of one up.
Right.
Oh, and Shannon, your dad, the story is unbelievable. You were young and you were 18 years old. And that story appears in the intro right from the get-go. And when I read it, I just knew I wanted to meet you because I felt the same. As a young adult, I experienced a traumatic hospitalization with my own father. And I'm pretty sure that it shaped my future in medicine and being so involved in patient blood management and patient advocacy like your father did. You took on training in intensive care to support your dad. You were his voice, his advocate, and you helped. That experience helped you to understand the importance of patient-centered care and shared decision-making with the patient and the family. Could you expand on this?
Sarah, I'm sorry to hear what you had to go through. But I think you'll agree that you look back and it's only then you realize how it shaped you, how it affected you. I mean, I look back, this was my first introduction to the principles of patient blood management. Patient-specific care, patient empowerment, and patient advocacy, and how important these are to patients. That was a traumatic time in my life. I was 18 years of age, and I remember the moment my mother and I arrived at the hospital and walked into the unit, and there are all the sounds of ICU, right? The ventilator, the breathing machine, the alarms. And there's my father, who had left home at 53 years of age, fit with a clean bill of health. He'd left to go to Canada to see his unwell elderly mother. And now here he is on all this life support, can't move, can't talk. He can only blink his eyes. He could feel everything. He could feel every itch, every discomfort, every pain, but couldn't move. And this went on for a long time, went on for 15 months. But, although this was clearly a traumatic time, the way the medical team cared for my father and for us made it so much easier. The anesthesiology team who ran the intensive care unit, they impressed me so much with their very patient-focused, patient-centered, we call it, and family-centered care to achieve the best possible outcome. They engaged us in all the discussions and all the decisions, and because he couldn't speak, I had to become his advocate. I had to speak for him. They never really worked out the cause of his paralysis, and we know sometimes that happens in medicine. But they were very open about this with us. They were honest with this. They talked about what the treatment options could be, what things they could try. but making very clear to us that there were risks and limitations, and they weren't quite sure whether it would work or not. They felt it might. And then they asked us what we thought. They allowed us to ask questions, and they allowed my father ultimately to make the decision.
Wow.
But they would also just drop in to chat with us, to talk with us and laugh and joke. And they wanted to get to know my father. They wanted to get to know us. They wanted to let us get to know them. Mm-hmm. Now, that sort of trusting relationship and open communication during a time of critical illness profoundly affected me and helped me understand what patients need and what helps patients through a time like that.
Yeah.
And if I can, one thing I want to add, Shannon has been on the front lines of trauma care and illness for many years, helping patients and families. And that's why the communication and patient empowerment with doctors has been so important to him and actually to all the authors of this book. And, you know, before the book was published, we gave a couple of chapters to a dear friend who was diagnosed with advanced cancer, who was facing major surgery and medical treatment. And his feedback was wonderful. How did he put it again, Shannon?
He said, one of the things he said was it really helped prepare him for entering what can be quite confusing medical system, you know, the compartments and the frustrations. He said it helped prepare him for that. There's a section on the book to try and understand what the doctor's going through and the nurses are going through in a complex health system.
Yeah.
And he felt empowered, and that helped him understand the various treatment decisions that he was confronted with.
Yeah. And he found the lists of questions to ask the doctors very helpul. Right.
Oh, good.
Clarified it for him. Yeah.
Yeah, I think it's a wonderful feature of the book. Yeah. And, you know, Kristen, thank you so much for joining us. You've really stolen our hearts and stolen the show. We'll try to give it back to Shannon a little bit. But, you know, Kristen, you really make me want to go into the other room and give my husband a big hug, because those of us in the medical community, you know, we always do better when there's someone at home that's supporting us and who's behind us 100%. And I can tell that you are that for Shannon. And I'm fortunate to have that as well. And, you know, sometimes we care for other people, and then when we come home, we almost need cared for. And so thank you so much for the role that you play in being able to give Shannon, you know, the ability to take care of people.
It's so
Sarah.
True, Sarah. I would not have been able to do what I've done without her incredible support.
Thank you, Sarah. And thank you, MaryAnn, very much. Thanks for inviting me. What you're doing at Let's Talk PBM is fantastic. We've been getting great feedback from people enjoying your show. Keep up the good work.
Thank you. Thank you so much.
Thank you so much. And y'all are making me cry here. So, thank you, Kristen. And, you know, come back anytime. And the Australian accents are just always welcome. We love it. We love it.
Absolutely.
Well, you may need to run subtitles. Okay. Thank you so much. Bye-bye.
Thank you.
So Shannon, the theme of empathy and communication throughout this book, you know, many people have not had that experience with their doctor. I'm glad that you did. But why is this such an important point?
Well, in simple terms, the simple answer is because empathy and communication impacts the outcome for the patient. Mm-hmm. And it really creates an environment where everyone wins. The whole experience is improved for the patient, the family, and the healthcare providers. I think it's summed up well in a quote in the book, if I may refer to that and read it, where we quote from, this is the chapter, Nothing is Scarier Than Having a Sick Child. Mm-hmm. And in there we quote from another book entitled Family-Centered Care in Birthing and Newborn Intensive Care Settings. It says, family-centered care in birthing and newborn intensive care centres that is genuinely respectful, supportive and collaborative creates lasting memories that can shape the views and attitudes of women and their families toward healthcare professionals and the healthcare system for a lifetime. So the sort of care, everyone involved in health today is incredibly under pressure, right? The strains and the pressures are huge.
Yes.
But what is important to remember if you're involved in healthcare is if you show empathy to patients, you get it back. It increases the satisfaction, which reminds me of a quote in the book. This is in chapter 1. There are a number of really famous physicians who understood this, and one of those was Sir William Osler. All involved in medicine will know him, one of the 4 founding professors at Johns Hopkins, Canadian physician, and he was regarded as the father of modern medicine. And he said this, and this has been a bit of a motto for me: care more for the individual patient than for the special features of the disease. Put yourself in his place. The kindly word, the cheerful greeting, the sympathetic look, these the patient understands. And really, this is what had such a profound effect on me, the way doctors cared for my father and for us.
It is really what the patients want more than anything. They want to be seen, heard, understood, validated, and comforted. You know, patient empowerment also hits hard a lot in this book, Shannon, and it's a hot button in the medical community. Can you explain what patient empowerment really is?
Well, that's a big topic, but I'll try and do it briefly. There are actually 4 elements around this. There's patient autonomy, patient empowerment, shared decision-making, and informed consent, or we like to call that informed choice now,
Yes.
which captures it well, right? Mm-hmm. So the first one, patient autonomy is a fundamental human right. Now, as is explained in the first chapter of the book, early in medicine, the doctor made the decisions and the patient obeyed the doctor's orders, right?
Mm-hmm. Yeah.
Now, this was called the paternalistic period of medicine. A change came about with this when the public became aware and were outraged at the medical experimentation performed on people without their consent around the time of the Second World War. Now, this was a major contributor to the establishment of what's called biomedical ethics, with its principle of patient autonomy. Now, patient autonomy is really the right to self-determination. That is, people or patients have a right to decide what will and will not be done to their body.
Mm-hmm.
And this is established by many international conventions. But many patients still don't or can't fully exercise that right. Paternalism still exists in medicine.
Yes, it does.
Yeah.
Sadly. Now, this is where patient empowerment comes in. It empowers patients to exercise that right, their right to autonomy. The World Health Organization defines empowerment as a process through which people gain greater control over decisions and actions affecting their health. So this really shifts the doctor-patient relationship to a partnership. The World Health Organization PBM policy brief, which you're familiar with and many will be from your podcast,
Yes.
links patient education with empowerment. So educated or informed patients are empowered to engage in the discussion, to ask questions, to talk about various treatment options. They're empowered to be involved in the decisions and the choices about their management. So they're exercising their autonomy.
I was thinking that we talk a lot about it, and we do this premise of patients have a choice, but until we really empower them through education, they are always going to see us as, oh, the doctor knows best. I don't really know this topic. And so then we're in a way taking away their power if we don't educate them properly.
Oh, yeah. Great point.
Yeah. Yeah, that's so true. So true. And that's what, of course, the book is about, is to empower and educate. So this then brings us to the point of shared decision-making, which means the patient now participates in the decision-making process. So their preferences are considered in the discussion about the benefits, the risks, and importantly, the uncertainties of various treatment options. And also importantly, understanding what if they do nothing? What if they have no treatment? That's important. And then the patient having had the opportunity to ask questions, to have time to think about what's been put to them, get more information, do their own reading on their condition and the treatment options, discuss it with others, with their family and friends, and then decide what is best for them in their unique situation.
Mm-hmm.
And of course, the patient has a right to accept or to decline treatment at any time, which then brings us to informed consent. Now, you've already had an excellent podcast some months ago on informed consent. And in simple terms, now after all we've talked about, the patient has made the decision about the treatments that they need. Now they've made this decision, they've reached this decision, now they need to give permission for the treatment to proceed. Now, clearly, this is not just signing a piece of paper, which often happens. Here's your consent form, read the fine print and sign. This is a whole process that really starts from the very first encounter with the health professional or the doctor. It starts and it continues up to this point. So research shows that all of this, that patient empowerment, better informed patients, shared decision-making, and informed consent results in greater patient satisfaction, better quality health decisions, and better outcomes. And of course, all of those are key in relation to blood health.
So true.
That's just amazing. That was such an excellent overview. Thank you so much. So in Grant's case, can we talk about Grant?
Love to.
Yes, Grant.
Love to talk about Grant.
Grant's story is featured in chapter 12. Nothing is scarier than having a sick child. And boy, isn't that true? Amazing. And he was, 9 years old when you first met him, and you were at his bedside during his illness. And, now some will say that a minor cannot know what's best for them. So let's talk about that. Should a child be empowered?
Look, it's a very good question. And just coming back to your comments, MaryAnn, all of those that participating put that chap together are just so committed to looking after babies and children. I'm very grateful to their wise input to that chapter. And yes, coming to Grant, wow, what an inspiring, courageous young boy, really young man he was. I got very attached to him and to his family. It was a great privilege to be involved with his and his parents' journey. And his parents were truly amazing. They were just there with him the whole way through and so supportive. And Grant had an impact on all of the medical staff that became involved in his care. And he actually influenced future treatment and management of children and families in the future.
Wow.
So to your question, in healthcare, there is a concept of mature age minor. So minors, if they comprehend the nature of their disease, the consequences and risks of proposed treatment, can make decisions for themselves in healthcare. That's a concept that's understood. And Grant proved to be a mature age minor. This was 1985. He was 9 years of age, as you said, and he was diagnosed with a high-risk form of cancer, childhood cancer, one that remains to this day a very challenging cancer to treat in children. At the time, it was considered an incurable disease, and most didn't live very long. Outcomes were worse if children presented at the time of diagnosis with multiple tumours. And if the cancer came back after their first treatment, the majority died within 12 months. Treatment was aggressive and still is.
Mm.
Now, Grant had all of those risk factors for a poor outcome.
Mm.
But Grant had very clear and strong views about his treatment and expressed them very clearly to the doctors, what he wanted and what he didn't want. In doing so, he was asking them to use some treatments that really challenged traditional management at the time.
Mm.
They were going to have to manage him differently. And the doctors were so impressed with this young boy that they agreed. They agreed to manage him the way he asked to be.
Mm.
And how they did it is really interesting. Now, whenever I saw Grant, no matter how unwell he was from the treatment, he always had this big smile. He had such a wonderful outlook, very positive, and this really cheeky and great sense of humour. Now, Grant outlived all his peers.
Wow.
He lived for 9 years from the time of his diagnosis. Remember, we talk about relapse and most die within 12 months.
Yeah.
9 years, far beyond what was expected. And he lived to see his sister get married and go to a wedding. He lived to get his driver's license, and he bought this hot red motor vehicle, which was his pride and joy, which he really loved. So he really got to do a lot of things. And the doctor said they learnt a lot from his care. And the lessons learnt from Grant and his care were applied to patients who followed. So this is a great example of family-centered care and shared decision-making, even involving a child, to achieve the best possible outcome for that patient or that child and the family and the medical team. PBM, really, right?
You know, when I read Grant's story, I became very emotional. And because, you know, from the outset that Grant is probably not still living today as you're reading it. And of course, you know, he does succumb after 9 years. He's not living today. However, he was a great example of a mature minor. And, you know, I think children who face these terminal illnesses, these serious illnesses, they do mature relatively quickly and they become very wise.
Yeah.
If you've ever dealt with them. And I know people have asked me before, you know, could you advocate for a child, you know, that maybe wasn't in your mind making the right decision. But yet we never want to see anyone, especially a child, pass with bad feelings or anything that would harm them mentally, emotionally. And so it's so important to consider their maturity and their wisdom over their own health care and what they want.
Yes. One of the lead doctors involved in his care said, we don't treat children in a vacuum. They're part of a family.
Yeah.
And the family and the child, they will be the ones who suffer the consequences of the treatment, its downside, the successes, the failures. And so really engaging them and not treating a vacuum was a very important part of his care. And it was a good outcome.
Yeah.
The best possible in his circumstances, that is, even though he did in the end die.
Yes.
But he lived a lot longer than expected.
Right.
Whew. Oh my goodness. Thank you so much for that story.
Shannon, thank you so much for speaking with us today. And now's your time to kind of leave our audience with a thought from you. Do you have anything you'd like to say?
Yeah, two things. First of all, for patients, be informed about blood health. Empower yourself to be part of the shared decision-making process with your healthcare providers. Partner with them. Make notes before you visit your doctor about what you'd like to know, the questions you'd like to ask. Then ask those questions. Ask about treatments. If you don't understand something, just ask for some clarification. Just say, I didn't quite understand that. Could you please just explain that to me again? Take notes. And remember, you can take along someone to support you, an advocate, which we've talked about earlier, is so important. that when you get hit with that diagnosis, from that moment on, the mind almost goes blank and you don't hear anything else that the physician says. And so to have an advocate there who can actually listen to that and remind you later is so important. So you can do that.
Yes, Kristen spoke to that so well earlier.
Yeah.
That we really need that support system.
Comes from our personal experience, know how important that is. Yeah. Then for clinicians, I love the words of Sir William Osler. It's much more important to know what sort of a patient has a disease than what sort of a disease a patient has.
Love that. That's fantastic.
Thank you so much. We hope that we are able to speak to you again.
Thank you so much for inviting me. It's been an absolute pleasure.